Hello everyone, my name is Justin Dave B. Gayed from Baguio Central University and I will be performing eye assessment return demonstration. Good morning sir, my name is Justin Dave B. Gayed from Baguio Central University and I will be your student nurse for today.
Good morning to you, sir.
Sir, I will be assessing for your ears and I will be palpating or inspecting of your ears and I will be performing the 3 different tests in order to identify if there is any problem on your cranial nerve number 8. Is that okay with you?
Okay, 1 second, sir.
Okay, sir. Rest assured that the data that I will be gathering in this assessment is highly confidential between me and the attending physician that I will be referring you to. Okay, I will now perform hand hygiene to prevent the microorganisms from spreading. I will now close the curtain to provide you privacy. So the first step that I will be doing is the inspection of the auricle, tragus, and the lobule of the patient. Okay, sir, I will inspect for those.
Yeah, okay, sir.
After inspecting for the auricle, tragus, and lobule of the patient, I noticed that the size is at a normal range of 2 inches. And for the shape, it is round and that is normal. And for the location of the patient's ears, they are both symmetrical. And for the discoloration, I haven't noticed any yellowish, redness, or bluish of the ears. And the color is at pinkish to light brown, and that is normal. For the lesion, I haven't noticed any scars, birthmarks, and no discharge is present. And for the third procedure, I will now palpate for the tragus and the auricle of the patient for the tenderness. Okay, sir, when I palpate for your auricle and tragus, please tell me if you feel any tenderness or any pain.
Okay, sir.
Okay, I will now palpate it, sir. After palpating for the tragus and the auricle of the patient, I haven't seen any sign of inflammation and any malformation. And when I palpate for the tragus and the auricle of the patient, I haven't heard the patient react, and that implies that he doesn't feel any tenderness or pain. Am I right, sir?
Yes, sir.
And for the fourth procedure, I will now inspect for the extra auditory canal of the patient. Upon inspecting for the external auditory canal of the patient, I've noticed that the cerumen of the patient is yellowish or to golden brown in color. And for the consistency, the cerumen is wet and sticky. And for the fifth procedure, I will now inspect for the tympanic membrane or the eardrum of the patient. After inspecting for the tympanic membrane or the eardrum of the patient, I noticed that it is grayish and pinkish in color. And for the shape, it is round and that is normal. And for the consistency, I've noticed that it is smooth and shiny. So next, for the sixth procedure, I will now check for the sensory nerve function of the cranial nerve number 8. In this step, I will be using 3 different tests: the voice or whisper test, the Weber's test, and the Rene's test. Okay, sir, I will now performing the whisper or voice test, and I will be staying behind you. Okay, sir, I will now test for your right ear, and to do that, can you please cover your left ear? Okay, sir, repeat after me.
H-A-L.
Okay, thank you, sir. Okay, next, let's test for your left ear. And to do that, can you cover your right ear, sir? Okay, and repeat after me.
H-E-A.
Okay, sir, thank you. Upon doing the whisper test, I've noticed that the patient is able to say the letters that I have whispered. After performing the whisper test, I will now proceed in doing the Weber's test. And on this assessment, I will be using the fork. In doing the assessment, I will strike this fork on the hard surface and I will place this fork on the patient's forehead and I will ask him if he hear any sounds. Are you able to hear sounds, sir?
Yes, sir.
Okay, the patient is able to hear sounds. After doing the Weber's test, I will now proceed to the last procedure, which is the Rene's test. I will be using this fork and I will strike it on the hard surface and I will place the base of the fork on the bone part posterior to the ear. Okay, sir, I will now strike the fork. Sir, are you able to hear sounds?
Yes, sir.
Okay, the patient is able to hear sounds. Using this fork, I will strike it again on the hard surface, and for this time, I will place the finger-like projection of the fork on the opening of the ear, and I will ask the patient if he is able to hear sounds. Sir, are you able to hear sounds?
Yes, sir.
Okay, the patient is able to hear sounds. Okay, sir, that ends our assessment, and I am very, very thankful for your cooperation.
You're welcome, sir.
Okay, rest assured that the data and the information that I've gathered in this assessment is highly confidential between me and the attending physician that I will be referring you to.
Okay, sir.
Okay, sir, please take good care of your ears and I wish you good health.
So you are too, sir.